Hi, this is Dr. Malik, the clinic director and chiropractor at UCC Physio. Today we're going to talk about osteoarthritis of the knee. Before we get into the osteoarthritis, let me just kind of give you a visual of what the knee looks like. So here's the anatomy of your knee. So here are your two bones, your femur and your tibia. In between these two bones, you have this joint, which is your cartilage. The main purpose of this cartilage is to provide a cushion between these two bones when you're walking or when you're running, so these two bones are not grinding on each other. What happens with osteoarthritis is that this cartilage starts to degrade or wear down. You start to lose some of this cartilage. It starts to thin. Once it starts to thin, gradually with time, when you're walking or when you're running, these two bones start to grind on each other. That's when you start to have pain. That's when you start to have swelling. That's when you start to feel a lot of stiffness. So what are the main causes of this? One of the most common causes of osteoarthritis is age. Just think of your tires on your car. The more mileage you put on your vehicle, those tires are going to start to lose some of its thread. So similar to your knee joints, the more mileage we put on our knee joints with walking, with running, all throughout our life, we start to lose some of that cartilage or lose some of that joint space in between the two bones. Most commonly, arthritis starts after the age of 50. And then gradually with time, as you grow older, your joint starts to thin down a little bit more and more. Now, you might be wondering, sometimes I have patients where they'll be like, hey, I'm only 30. I went to my doctor and he did an x-ray and he said I already have arthritis. Why am I getting arthritis at such a young age? It's a very good question. So there are other factors that can cause arthritis as well. So other common factors, joint overuse. So if you have an activity or if there's a job that you do that requires you to do a lot of squatting, a lot of kneeling, a lot of use of your knees, gradually with time, with that repetitive use, you are going to wear and tear down that joint. Other common causes, if you had a previous knee injury, if you've had a ligament tear like an ACL, or a meniscal tear, there are studies that show that those that have had previous injuries, they are more prone to developing osteoarthritis at an earlier age or a faster rate. Other reasons, weight, obesity. If you have a lot more weight that's being loaded on your knee joints, you are going to put more load and pressure on the joints, and those will gradually also cause a little bit of that degeneration or that wear and tear in your cartilage. Another common thing I see in clinic is not what's happening in the knee, but what's also happening in your hip and your foot. A lot of times you might have a dysfunction or an alignment issue in your hip or your ankle that can affect and put more load on your knee. Another common thing I see in clinic is when patients have flat feet or low arches. When you have flat feet and your arches are dropping in your foot, that can biomechanically affect your knee joints and cause it to put more load on the inside of your knee joints. And then that can also, gradually with more load, more issues like that, it can develop into degeneration or more joint load on your knee. Another common reason is hips. If you have weak muscles in your hip, such as your glute muscles, if they're not providing support for the hip, your next joint, which is your knee joint, might start to overcompensate while you're walking to compensate what's happening with the hip. So when patients come in with knee issues, we're not just looking at the knee, we're looking at the whole biomechanical kinetic chain. We're looking at the foot, we're looking at the hip as well. Just like the hip, the ankle can play a big role on how much load is going into your knee joint. For example, if you have flat feet or low drop arch in your foot, if your arch is dropping like this, if you take a look, your knee is also kind of rotating a little bit, which means you'll probably start putting a lot more load on the inside of your knee joint. As a result of this, and with time, you are going to start to have some degradation or some wear and tear in the inner knee joint. So a quick, easy fix for that is sometimes orthotics. What orthotics do is they actually help prop up your arch. So now your arch is not collapsing. Because of that, your knee will be a lot more stabilized. It won't be loading too much on the inside. Okay, so what are your signs and symptoms of osteoarthritis in your knee? What are you feeling? So if you feel like you have osteoarthritis or are wondering if you have osteoarthritis, typically when I have patients, they will have a lot of pain around their knee joint. So this is typically around the area, these little two dimples that you have, this is where most patients will start to feel a lot of pain. It kind of feels like it's going around the knee. Sometimes patients also describe it like it's around the kneecap. That's typically the type of feeling they get. With arthritis, it also does mean that you have some inflammation. So I have patients that will come in and they will have a lot of swelling around the knee. So it'll be really puffy around here. It'll feel warm to touch. If it's really aggravated, then definitely you will have those type of symptoms as well. The other thing I'm looking for is how their mobility is and range of motion. Typically with arthritis, you start to lose some range of motion and the knee feels really stiff. For this patient, he has full range, but if they had a little bit of arthritis, they might only be able to get to about 50% of range of motion. Then they'll say, oh, you know, I feel some stiffness, some pain here when you're bending it in. So they're not able to fully bend the knee in. Similarly, they're not able to fully extend their knee. So this is fully extended. If I had a patient with arthritis, they might be a little higher. When I try to push down to get full straightening or extension of their knee, they start to feel pain and pressure in this area. What I'm also looking for is what's happening with the muscles surrounding the knee joint. As you know, your quads, your hamstrings, these muscles play a vital role in providing support, strength, and stability for the joint. So if you're really weak in your quads, if you're weak in your hamstrings, that can cause more load on your knee joint. So I'm going to be feeling around to see how these muscles are. If it's tight, sometimes your muscles might be really tight and they might also be weak. So that is something that we have to focus on in terms of treatment, trying to reduce some of the tension here, which will also reduce the pressure and load on the knee joint. How do we fix this? When patients come in at UCC Physio, we do a comprehensive assessment, taking a look at their ankle, knee, and hip, seeing the biomechanical and kinetic effects of what's happening in the knee. And then from there, we make an individualized treatment program, specifically focusing on your condition. So in terms of treatment, we're focusing on trying to, one, restore your mobility in your joints. So we're gonna try to improve your mobility by stretching out the knee joint, trying to get back full range of motion, not just in bending, but also in straightening, as well as start releasing some of the tension that's in the muscles surrounding the area, especially the quads. I find with osteoarthritis, the quad muscles tend to be very tight and stiff. So we do a lot of manual therapy, soft tissue therapy, where we work on patients' muscles and try to reduce some of that tension and loosen it out. And then one of the most important things to maintain your joints so that you don't start to lose more of it is doing strengthening exercises and just general stretching exercises. So it's always good to have a good exercise program that you can work on daily to help prevent more loss of range of motion and more loss of that cartilage in your joint. So first one we're going to do, I'm going to get you to, we're going to bend this knee for stability, and you're going to bring this leg up straight, just up to that knee level, okay? And then once you get to there, you're gonna hold it for 2-3 seconds. Okay, bring it back down. And then, so every time you bring it up, you hold it for about 3 seconds. Go up again, 1, 2, 3, down. Okay, and then you're gonna do that 10 times. And then what you're gonna do is so I'm gonna have your hands on the side, okay? You're gonna keep this a little bit more out. And then you're gonna lift your hip up and form a bridge. Ready, go. Hold that up, 1, 2, 3, down. And up, 1, 2, 3, down, and up, 1, 2, 3, down. Now we're getting the hip involved as well. We want to strengthen the hip to also provide support for the knee and reduce some of that tension and load on the knee. An easy exercise you can do at home, or even when you're working, if you have a desk job, is just do some leg kicks. So you want to straighten that leg out, up, hold it for 3 seconds, 1, 2, 3, bring it back down. Raise it up again. What you're doing with this is you're activating your quad muscles. It's helping strengthen it, and it's going to help provide support for the knee joint. 1, 2, 3, down. I also find acupuncture works really well in reducing some of that tension and pain that patients are feeling, especially in the muscles surrounding the knee joint. Acupuncture, its main purpose is to help promote blood flow to the area, reduce muscle tension, and also to promote healing response. So if you're ready to finally get back to living your life without pain, book an appointment with us by clicking the book online button. Or you can schedule a free phone consultation with myself by clicking the free consultation button on the bottom of your screen, so I can answer any of your questions that you may have. Welcome to UCC Physio. Your recovery begins here.